It's just wonderful that we're here, and you can tell I know most of you, and we've got to know each other through this process. And why am I making this fuss today? Now more than ever, I need your help. From time to time, I've come to you and said, I want to make a step change in the narrative that we're stating and the position that we're taking. I'm there again today. I want to make another step change. I'm going to tell you what it is. It won't feel dramatic compared with 2 weeks ago, but it is an advance. I hope that when I've spoken, that I can get some of you to comment on it and that you will have put your details in the chat. So my starting point is constantly to say this virus is not going away anytime soon, which means that it will continue to be affecting the world. And the question is how to ensure that this virus, whilst it's continuing to stay here, can affect the world in a way that does not provoke major actions which damage economies, damage societies, and damage people. So whilst I'm okay with the slogan being used in some places about needing to live with COVID, I'm going to say that we need to be ready for COVID, and we need to act in a way that minimizes its consequences for people and for societies. And that means that I would like to offer you my 6 elements for what I think are necessary to be ready for COVID. First is to understand what we're really talking about here. We're talking about controlling an infectious disease. And so my first point is the virus is the problem and people are the solution. People need tools and guidance to help them function effectively. And so people need the support of governments, of their employers, and of other authorities to be able to work to their full potential in bringing that solution to life. So that's my first point. Virus is the problem, people are the solution, people need tools, people need guidance, and there is a vital role for governments to help make that happen. Number 2, in order to be ready for this virus, it is necessary to understand what it is doing. And to understand what the virus is doing, there is need for information about where it is, how it is being transmitted, what effects it is happening, and that information needs to be widely available. So it is absolutely essential that we build in to the COVID-ready state the capacity to do the necessary tracking of the virus through testing people in society, testing people who are feeling ill, testing people in institutions, to keep an eye on what is going on. So point number 2, understand where the virus is, what it is doing through good testing and epidemiology. Number 3, make sure that the systems are in place to deal with potential surges of the virus, especially if those surges are associated with new variants. The pattern that we're seeing around the world at the moment is that this virus tends to surge up and cause increasing levels of disease about every 4 months. It's not precise. and the size of the surge and the interval before a surge depends on an enormous number of factors, including the susceptibility of a population and the degree to which virus is being distributed. But in general, the pattern seems to be 4 monthly surges. And so, in order to be COVID ready, have systems in place to anticipate, detect, and then respond to these surges. Those systems might include restrictions on people's movements in localized areas. Those restrictions might include requirements to wear masks in public transport. And the key thing is that the people need to know what it is they will be asked to do if there is a surge, and that means having the systems in place. Number 4, the way you try to reduce the risks associated with this virus is by increasing people's immunity and reducing their exposure. To keep immunity high, we have vaccines. The efficacy of these vaccines varies a lot, and it will also vary when additional variants come along. At the moment, it does seem that the vaccines that are made from messenger RNA are the most effective, but there are other vaccines that have been made using more traditional techniques that are also quite effective, but there are some vaccines that are definitely known to be less effective than others. And if you want, I can talk about that. But the point I want to tell you is that after you have been vaccinated, the protection in your body drops off over time. And in older people, it drops off quicker. But in general, we work on the assumption that there is a marked drop in protection 6 months after immunization or 6 months after one has had an infection. There are huge differences between individuals, and that is just a rule of thumb that I have used. The fact is that some people seem to be able to have very high immunity for a long time after immunization or infection. Others, their immunity seems to drop off very quickly. And it's super hard to predict which are the people who are going to have waning immunity rapidly and which are the people for whom this process is slow. But what I have to stress to you is that the immunity does wane, and it wanes in a matter of months, and that it wanes more quickly in relation to natural infections than immunization, but that there is a difference in the rate of immunity waning depending on which vaccine we're looking at, and that immunity seems to be overcome more actively by new variants of virus. And so the new variants of Omicron, we're looking at those very carefully to see whether they are more easily able to bypass immunity than some of the older variants. So hold that. My 4th point is immunity wanes after immunization, wanes after infection. It varies an awful lot between individuals, but the older you are, the more rapidly your immunity wanes. And then my 5th point is just to remind you about what are the key elements of being COVID ready. I've already said that people are at the center. Then I want to say that the vital thing to do is to prevent transmission, especially if you've got numbers of cases picking up, and we prevent using masks using physical distancing, using hygiene, and using ventilation. Our 4 activities: masks, physical distancing, hygiene, and ventilation. And in particular, we still encourage masks in areas that are confined, because we do not believe that anybody should be exposed to COVID if it can possibly be avoided. So if people do have to meet together, and if there is a possibility of COVID being around the place, we strongly advise wearing of masks to prevent transmission. As well as preventing transmission, we say protect all people from severe disease. The best way to protect is through vaccination. You can also protect through shielding, but ideally, if you've got people who are particularly susceptible and you're worried about them, a combination of vaccination and shielding may be necessary. And remember, the role of vaccines is to protect people from severe illness and death. At the moment, we do not believe that vaccination actually prevents transmission. And that is a very important point, and I'm very happy to come back to that if you want me to. An additional step in my list of things that we need to do is we need to prepare for surges. And so that means preparing for what people should be asked to do if there's a surge in a local area, and that is likely to include movement restrictions for a period of time whilst those who are infected are discovered and are helped to isolate, their contacts are traced, and there is an overall process of doing everything possible to interrupt transmission in order to stop the surge from developing into an explosive outbreak. So that is my basic story of what has to be done. People at the centre, preventing transmission with masks and distancing, hygiene and ventilation, protecting those who are vulnerable through vaccination and through shielding, and preparing for surges, making certain that the public knows what is expected of them in order that the social contract between government and public is well understood. So everybody, that is my story, and I'll just go through it once again, but in headlines, because I want to be sure that I've got it across. Part 1. This virus is here to stay. The virus is the problem. People are the solution. The virus is dangerous. It can cause acute illness, especially in the vulnerable, but can also cause long-term illness or long COVID, and that means we must take it seriously. That's my number 1. My number 2. It's necessary to understand the virus, to work out what it is doing through readily available testing and epidemiology in order to know who is infected, where they are and how they've been infected. One thing we have learnt over time is the virus tends to preferentially hurt poorer people. Number 3, there are going to be intermittent surges of virus at around 4 monthly intervals, it seems at the moment. The frequency of surges depends on the susceptibility of people and also the nature of the virus to which they're exposed. If there are new variants, there is a high likelihood that they will be more readily transmissible than earlier variants. But whatever happens, everybody everywhere should be anticipating that this virus will surge and will then calm down, surge again and calming down. That seems to be the pattern that we're seeing around the world. Number 4, you can get immune to this virus through having the disease. You can get immune to this virus through being vaccinated, but the immunity does not last forever. It wanes. In older people, it seems to wane more quickly than in younger people. The immunity is more likely to wane with certain vaccines than with other vaccines. Immunity seems to last longest with the mRNA vaccines. Immunity can be overcome if the virus undergoes mutations. So all in all, understanding what this virus does to populations depends on understanding the level of immunity and how that is evolving, and understanding what kind of virus concentration and variant is affecting people. But getting an appreciation of waning immunity is hugely important in understanding what this virus does in any population. And number 5, people are at the center of the response, and the emphasis should be on preventing transmission of the virus, especially when there is a lot around, through masking, physical distancing, hygiene and ventilation. Then secondly, there should be emphasis on protecting people who are vulnerable with vaccination or with shielding. And thirdly, preparing for outbreaks. What I have not mentioned is that there is still unsatisfactory international coordination on responding to COVID-19. There is not a widely accepted narrative on what is happening. This narrative that I'm giving you now is in line with the WHO, but it is not one that is generally accepted and understood. And so I am making a particular plea, though in this meeting it's not necessarily relevant, but it is internationally, for more effort to get the global architecture right. Those are my basic points that I want to say. And I thought I'd finish by just making a number of comments. You know, if it is going to be necessary to understand where the virus is, then it is necessary to have well-functioning systems for testing people, either through sample surveys or through having easily accessible testing for those who've got symptoms or those in high-risk occupations. But if testing becomes hard to get, then I have to tell you that the information that we will have on what the virus is up to will become very, very unreliable. And we are in that situation at the moment. In order to try to deal with this problem of testing, I am advocating for more resources to go into research for developing more reliable rapid tests, like the ones that we've all been using to test our own COVID status, what's called lateral flow tests. They're not good enough at the moment, but the research going into diagnostics is much, much, much less than the research going into vaccines and the research going into treatments. And we all need to fight for greater investment in testing and for more widespread access to testing throughout the world, and not this current situation where actually testing is not easily available in poorer countries and is still far too expensive, and the tests are not good enough. So that is my opening remarks. I'd now like to invite Catherine to just bring in Pete and his picture, but also to tell me who's on and who might be prepared to speak. And Megan, I see you're lit up. So after I've heard from Catherine, if you've got a decent internet connection, Megan, I'd like to call on you to give us your report from Botswana. Let's just go to Catherine first.
Hi, everybody. Pete, do you mind pinning your illustration for us so we can take a look at it? Oh, awesome. Will you walk me through a little bit of it?
Hello. Hi. Okay, so I guess I've gone for the headline statement. Well, the initial statement, this was a very eventful time internationally, and then I've gone for the list underneath this bit to the right. We need to be ready for COVID and minimize its impact. And so we've got the list here. I've got support people, and then next to that, the virus is the problem and people are the solution, which is a key statement that I pick up on a lot. We've got the understand the virus and communicate the data well. So next to these are various icons that represent these things. So we've got testing here with a label good and cheap with good data next to it. We've got these various measures like distancing and mask wearing and ventilation next to reduce transmission with measures. And then also we've got this point about immunity with somebody being jabbed in the arm with the vaccine, and then a few subheaders or side notes about immunity to the right. So just picking up on those key points and reiterating them for you.
Thanks, Pete. What I like about your illustration today is that our briefing and preparation for this, you've managed to capture all the biggies, including keep testing widely available. It's brilliant, Pete. Thanks so much. Really, really appreciate it. I look forward to seeing it at the end when it's done. So today, David, the chat has gone lively in the last few minutes. Just to let you know that Claire Rayner's with us, but she's on her phone, so may or may not be able to speak. But Peter and Marianne and Rebecca and Alejandro Alcantara all have interesting things to say. Marianne wants to talk about the impact in developing countries, particularly on schooling. And Alejandro wants to talk about the 24-hour news cycle and how we manage to combat that in terms of keeping people's attention on the things that need to really be focused on. I will send you a couple of messages in our WhatsApp so that you have a little bit more information, but Megan, Claire, Rebecca, Alejandro, and I know Adrian is asking how many people are from the US. I don't know the answer to that, Adrian, but I'll see if we can find out. David, back to you.
Thank you very much indeed. Great to get it, and thank you. Laura Spinney, I just wanted to check, are you on? No, not on this week. Okay. Frank Atherton, would you like to go first, please? And then I'll go to Megan Matefa if you're easily available.
Yeah, thank you very much, David. And thanks for that framing. Can you hear me okay?
Yes, perfectly.
Good, okay. So, yeah, I recognize that framing. It's very helpful. You know, I want you to talk a little bit about one of the really important elements, which you've touched on several times during these briefings, which is about population behavioural change and how we take populations with us, really. You know, in Wales, just as context, we are in one of those surges at the moment with the BA.2 subvariant of Omicron, and that's kind of leading to large-scale community transmission, but not a great deal in terms of, you know, it is leading to some hospitalizations, but nothing in terms of serious harms. But it's something that we need to take very seriously. And yeah, we are in the process of moving from restrictions based on legal restrictions towards more guidance and working with populations. I think that's something we've really learned over the course of this pandemic. And in fact, there's a think piece which has been produced we have a technical advisory cell here in Wales which assembles the evidence, and I've just seen it this morning. It's a fantastic piece of work which really synthesizes in the best way that I've seen the behavioral change approaches that we might want to use. And in a week or so, a few days, I would hope to be able to share that, and I'll send you a copy, David, when I can. But just to summarize it, there's some really important principles in there. And then the ones that you have mentioned, I think, first of all, is that people are sick to the back teeth of this and they really want a way out. And it's really important to thank them and acknowledge what people have been through. The second thing is that we need a simple framing. And if we can make it binary, that's so much the better. And the approach we're taking in Wales is to have, in future, a COVID stable situation and a COVID urgent situation. I think that speaks to your points about being ready for surges. You know, that if we get into a next surge, particularly with a new variant, we may need to tell people this is now a COVID urgent, and a binary message is a simple one to get across. The third point really was about acknowledging the uncertainty in all of this, and particularly uncertainty around new variants, of course, and the public needs to know that point, which I think you've stressed repeatedly, it's not all over yet. And the fourth one, there's a couple of others actually, but the fourth one, really important, is that we need to keep a strong focus on inequalities, because messages don't reach people to the same degree everywhere, and so we need to really target our message. Oh, there's a final one, which is that if we can embed some of these risk principles and get people supported and enabled to kind of manage their own responses to the virus, that will stand us in really good stead on a range of other things. I know you're interested in food security, but also climate change. So literacy around understanding and dealing with risk is something that we need to pursue in the public health world. Simple as that. But I will share that paper as soon as we can, David.
That just sounds fabulous, fabulous, honestly, Frank. And thank you for sparing the time to join and for connecting with us in the way that you do, Frank's style. I'm super impressed, and I look forward to more. Everybody, the conversation's now well and truly open. Frank may have to clear off. I don't think we can assume he'll stay with us. I see that we have people doing the right thing, which is to put their hands up. And so we'll come down, but I do want to say that I want to check, Marianne, are you ready to speak? Because I did say just now I wanted you to speak and I saw you unmuted. So can I let Marianne speak, Antonio, and then I'll come to you immediately afterwards. Sure. Marianne, please, you have the floor.
Thank you, David. Hello, everyone. I think you haven't seen me for the past 2 weeks. Things in Botswana are improving, but not so much, because I actually traveled some 2.5 weeks ago to Durban. There was a tournament there. So when I got there the first day, I actually said to myself, oh, what have I done? Because when we got to this golf tournament club, it was a fundraising tournament. They were from Africa, some from UK, New Zealand, and Australia. And there was no masking. People were having dinners. I think I was the only person wearing a mask, and we were using Eurocar hire, you know, those mini buses that carry people to and from hotels to the tournament. I actually tried to talk to some people that we should be masking. Why are we not masking? People were sanitizing, but I think that's not enough. I just want to reiterate what David was saying. We should still try to maintain and keep ourselves safe. So as if that was not enough, after a week, I started feeling sick. I was still in Durban. So I managed to get back, because Botswana, you don't have to test now when coming back if you are fully vaccinated. I had had my booster the following week, the previous week before traveling. But when I got to Botswana, I couldn't move. I couldn't do anything. So I'm still sick with COVID as I speak. And I haven't been out of the house in a week, though I did all the tests and I'm trying to get myself well. So I'm actually disappointed that I got COVID when it was like now like we have lower numbers now. When they were higher, I managed to stay safe. So I'm actually disappointed, and I don't think I will want to travel again. because I think I exposed myself by traveling. So I just want to say, let's stick to the rules, because I think it really helps. That's all I have to say, David.
Thank you. Honestly, our sympathies. Everybody, Megan says she got COVID when she traveled. And the reason why I suspect she's not 100% joyful is that she knows, and the rest of us also know, that you may get a long, lingering, nasty, residual trouble as a result of your COVID. And none of us want that. And that's why we're doing our best to avoid it. But let me just give you one piece of advice, Megan. When you've got the COVID, don't force yourself to come rushing back to work. Don't force yourself back onto the golf course. Don't force yourself to go out on runs. The evidence suggests that those who are really pushing themselves hard seem to get sometimes a longer period of long COVID or post-COVID discomfort. So please look after yourself very carefully and do not push it. If Claire Rayner is on today and wants to say anything about this as well, I would like her to do so. There are others on this call who work really hard in their lives to avoid COVID and who have subsequently got infected after 2 years. And if any of you want to reflect on that feeling that obviously Megan has, please do in solidarity, because I'm well aware that it makes people feel super frustrated. Your frustrations are felt. Megan, thanks for being with us. Let me move on. And by the way, anybody who wants to come back, please do so. I can't see all the time who's on, but Antonio, please come in and tell us where you are and perhaps a little bit about yourself, and then you
Hello,
go.
Dr. Nabarro. I am.
Hello.
Can you hear me, Dr. Nabarro?
Yes, I can. Call me David.
Okay. Hello, David. First of all, thank you very much for the opportunity from the work that you have been doing with WHO in this important matter. I am a consultant. I'm here based in the U.S. I'm also, even though I work in business consulting, of course, I always very curious about this social and economic implication of a situation like this, the public health situation. So my question, Mr. David, was along the lines of you mentioned about preparedness. Of course, it's important to be ready to contact trace and so on, which is something that we have to do right away. But also the narrative itself, for some reasons, I know that we have a propensity in our economic system, in our political system, to be short-termists. We don't think long-term, but it has been very difficult to incorporate the long-term perspective on this, on the narrative for COVID, for the importance of fighting COVID. What's your perspective, Mr. David, about the level of preparedness we are for what we likely coming as the social and economic implications of long COVID? How prepared are we? Are we in deep trouble that we should be paying attention now? Thank you.
I'm very glad to say that thanks to the efforts of some of the people who are on this call, including Claire Rayner, together with some of the people who are in the World Health Organization, including Maria Van Kerkhove, that there is increased willingness to understand that there is a long-term dimension to this challenge. And as we get more and more data, we are clearer on what the long-term realities are. But I would agree with you, Antonio. I do not personally understand how there can be such denial of the reality of long COVID by so many nations. It's a kind of collective denial. And I'm particularly frustrated that this collective denial is coming now, just at the time when many countries are going into a period where they perceive that the risks are decreasing, but apparently they are dropping all the precautions far, far too early. And it is really hard for myself and my colleagues who've been working in infectious diseases to fully understand how on earth governments that have invested billions in managing this pandemic can now make decisions to reduce or even completely stop some of the precautions that have been introduced at a time when most of us who've got knowledge of the issues would be saying it is more important than ever to be careful, because we know you must be careful as you're coming down the epidemic curve. That's just the time when there is a huge risk of resurgence, because people just simply are so bored of what's going on that they cannot maintain the precautions. So I'm just going to say to you, Antonio, number one, there is a need for greater attention to long COVID, both its human and economic consequences. And number two, there is a need for greater appreciation of the importance of public health and social measures for preventing transmission as the primary means for preventing long COVID. I do not, I'm afraid, know at this stage how effective vaccination is at preventing long COVID. This is one of those areas on which we have early data but no conclusive results. So that's why I will say, you want to prevent long COVID, you want to be prepared, keep the public health and social measures going, even longer than you feel is really necessary. That is the sensible precaution. But stopping them quickly, particularly when incidence levels are high, that seems to me to be an inappropriate use of infection control protocols and public health. Antonio, I hope I'm clear. If you want,
thanks, Dave. And just a quick follow-up.
Yeah.
I think we should. You mentioned precautions, that removing precautions, but I think we should also apply the precautionary principle, right? We don't have the data yet, but the precautionary principle says if there is a possibility something can go wrong, you have to pay attention to. Thanks, Dave. Thank you very much.
Antonio, so agree. I put my email address there. I mean, it's pretty public what it is. Our team would like to hear from you and follow up with you if you want. I mean, that applies to everybody.
Thank you. My pleasure.
Thank you. Claire Rayner, please. I can see you there. I know you're connected by your phone. I'm just really, really keen to hear from you on long COVID. After you've spoken, just 2 seconds, I want to come to, I'm going to invite people who want to talk about what's happening in the Black Sea region and its impacts and the possibility of COVID transmission, but also the associated challenges on climate change and on costs of food and fertilizer and energy increasing and conflict. And if you want to talk about all these different things coming together, I'd be very keen to do that. And I know from the chat that several of you would like to talk about that. But for now, it's long COVID moment with Claire. And if anybody else wants to talk about long COVID, please put your hand up in the using the hand raise function or shout out quickly. Claire.
Hi. Hello, David. I've just pulled over in the car, so I'm going to go off video, but just to make sure my sound stays okay. Yeah, I agree with absolutely everything you say, and I also hear Antonio and agree. I believe that the mitigations. Oops. Can you hear me all right?
Yeah, you're super audible, really good.
Okay.
No interrupt.
Okay, lovely. So I'm actually very frightened about what's happening to the UK population at the moment. There are 1.5 million people with long COVID as defined over 3 months. But what I know from the people I know is what's bad. We've got people who've never recovered and who are very ill from the first time, now reinfected, and they're now incredibly ill. I know so many professionals, teachers and healthcare people who are 2 years out of the system, 1 to 2 years out of their teaching or healthcare provision. I know parents who have now had to take a year or two off to look after their teenagers who are incredibly ill. It really bothers me that all mitigations have been taken away. I don't know what the effect is in somebody who's already had COVID meningitis and continued with long COVID who is now reinfected. They are treating some people with antivirals or MABs who are considered to be vulnerable. But surely this is at huge cost compared to what it would be to put preventative measures in. And like you, I do not understand it. But I think we've now got 400,000 people on the waiting list to be assessed for benefits. You know, don't tell me this isn't going to absolutely have a massive impact on our economy. I believe that treating people earlier will prevent the severity of long COVID. I think, you know, that's my opinion, but it's anecdotal, and there's a lot of evidence coming through that some people who've had treatments in the more acute stage and who've rested fully get back to activity more quickly. Yeah, I don't know what else I can say. I'm just so concerned, really. I don't know if that helps.
Well, all I can say to you that your advocacy and the advocacy of others with whom you've worked, some of whom have joined us on these calls, your advocacy has been so important. Sometimes it's hard to draw a direct line, a sort of linear line between intensity of advocacy and action being taken by local authorities, national authorities, or global authorities. But Claire, I know that the work that you did, the work that Robin Gorner has done, the work that Paul Garner has done, the work that the colleagues that you brought onto these calls have been doing, that work is getting through. And it's tough. It's tough. It's tough for people to know how to react to this long COVID because it's still being defined. It's a very loose syndrome, but please keep it up. And as a systems leader, which you are, I want to tell you that one of the difficulties about being a systems leader is you never know how effective you are. You're always acting a bit in the dark. Please take it from us, all of us here, your peer group, your family, that you are achieving good stuff, and just keep going. Don't stop. It really matters.
Thank you so much. Thank you. And I will do, and we'll see how it all turns out. So thank you very much.
Okay, on behalf of all of us, how about that? Let's just go. Who would like to come in on Ukraine? If you want to release your microphone and shout out if you want to talk about Ukraine, I'm very keen to do that for a little bubble now. Anybody? Yeah, add please. Thank you.
Yeah, David, it brings me back to the times 10 years, 15 years ago, where you had a very important position in the food, fuel and fertilizer crisis. And what we hear from the colleagues, what we hear on the radio, television, we go to enter a very, very difficult situation with food supply in North Africa, in the Middle East, and other parts of the world. And I was just wondering, it is not really at the core of this discussion this afternoon, but as you and John underlined so much, this cost of the climate, the COVID, the conflict, that the cost of the food is going something very, very worrisome. And a healthy person needs good food. And I would very much, you as doctors and medical people, how you see that, how we can make it a stronger point. You hear also the Undersecretary, the UN Secretary General last Monday. Many people are really very, very concerned, and all of us included, how we see that and what can we possibly do in this group to get a certain discussion discussed from the COVID, the bridge to the food to the poor people. Thank you.
Thanks very much, Ad. Everybody, on the 14th of March, the Secretary General of the UN gave a speech that he had prepared for quite carefully about, and here's his title, The War in Ukraine. About the first page of the transcript of this speech is about the impact of the war on people in Ukraine. The next 3 pages are about the impact of the war on the whole world. And basically, Antonio Guterres is saying that billions of people in our world are suffering, but are going to suffer an awful lot more as a result of the domino effect of a number of things triggered by the war in a world that is already very damaged because of the impact of COVID-19. And so Mr. Guterres' analysis, as Ad Spike has just said, talks about COVID, climate change, costs of energy and food, and conflict, all coming together to create a really difficult crisis situation for billions of people in our world. And for the first time since I've really known the United Nations, they've come up with a really new construction, which they've called the Global Crisis Response Group on Food, Energy and Finance, that they are actively going to focus on the triple problems of rising food prices, rising energy prices, and more squeezed balance of payment situations. But this is going to require a most incredible coming together of minds and of hearts to do things quite unusually, because all the projections are that even if this war stopped tomorrow, things are still going to be very bad. You just can see it. One is we're going into a real resurgence on COVID, as I've just said, and it's going to happen in the coming month or so. 2, we're going into higher wheat prices, higher sunflower seed prices, and indeed higher prices of meat and of other food products, together with higher fertilizer prices, just as a big chunk of the world is going into a major religious religious observance called Ramadan. And all this is happening at a time when there are just increasing numbers of conflicts in all continents. So this is difficult, and just to say, Ad, I think that you picked up on this announcement, and I've been asked to be a bit helpful on setting this thing up. So yeah, it's happening, and thank you for pointing it out. Marianne Hasselgrave, please.
Thank you. Obviously, I want to mention about this because it's when you told me, and I read the full amount of the full speech of the Secretary General. He doesn't bring in climate change, and he doesn't bring in health. Now we have to add those in, because this requires a really interlinked approach. I saw about the issues to do with food, and one can see in a country like the UK, suddenly the price of butter went up 10% in 2 days. That doesn't matter, but when you look at wheat, that is something that is global, and the impact in developing countries. We have to be ready. We weren't ready for COVID, and even now, talking to people in developing in Uganda, who are in positions of influence, a lot is not known. But we have to have information, good information, and solutions to how we approach it. Thank you.
All to say that Marianne kindly wrote to me actually before I saw the Secretary General's speech and just said, do you all realise what's just around the corner? And it was interesting, Marianne, just about the time you were writing that, I was getting signals that this is really worrying the whole UN system. You mentioned that it's important to keep the climate change in there. It's important to keep the health in there. I know that Mr. Guterres is very conscious of that. but he's also super worried about just how much people can take at the moment in terms of bad news. But yes, it's all coming together. The COVID surge, some people call it wave 6, the food prices and energy prices going up, effects of climate change, terrible drought in Latin America, real problems of climate also in Asia and Africa, and already the temperature is super hot in the Middle East, and there is big drought, plus all the conflicts. I would agree with you, this is giant. Everybody, we will talk about this during these briefings. I'm very happy to look across at the food work and at other pieces, and as much as you want to come and to talk about that and bring others, and if you've got, as I'm seeing in the chat, information about your food basket that you want to share. Miles Breeden says that the Kenyan food basket has gone up by 11%. Well, that's really making a difference to poor people. We know that from other work. 10% rise in the food basket is a major problem. So thank you, Miles. Let me go to John Atkinson, please. John.
Hi, David. So I aligned very quickly with Magen's story. I've had COVID for about 11 days now. Think the test today is clear. I'll do another one tomorrow to see. But like Marianne, I think it was traveling and being in vehicles with confined spaces. That's what happens. Interesting effects on your brain. I've been very lucky. I think I'm 57. I've had my three jabs, and I'm relatively fit. But even so, it really does interfere with how you think about things and how you do things. So if I seem a little garbled today, apologies. A quick leadership thought, David, in all of this. I think it connects to things that many people have said today, including Marianne and others. For me, elections are a bit like popularity contests, but leadership is not. If you think you're going to lead something by doing the popular thing, playing to the crowd, you're going to come unstuck at some point. And people tend to confuse the two. They think because they've won an election, they're a leader. If you don't challenge narratives, stories, events that are unhelpful, people assume that tacitly you're accepting them. If you shy away from those conversations, whether it's at the very smallest level, whether we don't put a mask on in places where we know we should, to global leaders not addressing things that are happening in their countries. I said 3.3 million cases in the UK. There's not who knows what the real number is. We can argue that, but there's hardly a squeak on national media. Nobody's talking about it, and it's going to matter. So it isn't all over. Pretending it is, pretending we've won our freedoms back or whatever else is not helpful. And I think the points that you made at the beginning, where you started off by saying, people need tools and they need guidance. They need to understand what's happening and what the impact is, and trying to pretend it's all okay is not a smart or sensible way forward. So I'll go back to where I was last time, which is we need to tell the story straight. We need to tell the story clear. We need to frame it so that people can make the choices that they need to do.
Love you, John. Peter Hebard, and I would like to give a moment to Katie Gardner, if she wants. Peter Hebard.
Thanks. Firstly, just to go right back to the beginning, what you said, David, was spot on. And coincidentally, I have written to you really offering some ways to deliver and make happen what you actually said, how we prepare for the next pandemic, or in fact these latest surge, learning from the East and West. It was significant that Hong Kong did brilliantly at the beginning, but they're in real trouble because they didn't learn from the West how to manage a vaccine. As engineers, we are always focused on solutions to all of those problems that have just been listed: energy, climate change, and so on. And following on what's just been said, what we know, because we have to manage human behavior on production lines and telling them how to work our products, not wreck them. We know you have to tell people exactly what to do, why to do it, when to do it, where to do it, and they have to have confidence that it will work. And therefore you have to give them the best equipment, and you will know the key thing is that we could give them a much better mask. Part of the reason why people don't wear masks is they don't believe they work, and they look at them and think, well, what's this rag? It's not going to work. So if we give people something that will really work. Anyway, I've put something in the chat. If anybody wants to know the 4 key lessons from East and West, I put them to you, David, and anybody else can share them. I'm sure Catherine will pass them on.
Peter Hebard, you are persistent, you are tireless, and as far as I'm concerned, you are amazingly effective. Please keep it up. Please keep sending us the stuff. Please send things to Mahika at 4sd.info. She can then put it into our social media platforms, and she can share it with people on our LinkedIn group. Thank you again, Peter. Katie, would you like to say anything?
Well, yeah, I'm sorry, my voice is not good because I've got COVID, and I agree with John and the people that have spoken. Certainly in England, lifting of restrictions seem to have been taken by people as, you know, it's all over now, we don't have to worry. And I've been terribly, terribly cautious, but my partner's a city councillor, and the city council are having meetings and they're not wearing masks, and he got COVID and I got it from him. So after all this caution and me sitting in a crowd, you know, in a place on a bus with being the only person with a mask and sitting in the corner, and I've managed to get it. And I just think that this has made me think that there is a lot more that we have to do about understanding of risks, because people, it's being now assumed that you'll be responsible. And I'm not saying that people are not responsible, but we all want it to be over. Even a doctor friend of mine said the other day that she was very surprised at the number of cases because she thought the pandemic was over. Well, she's a GP. So if GPs don't have an understanding, then, you know, there is a lot more to be done. And I think I'm going to write to my MP immediately and ask her to ask a question in the House of Commons. Thank you.
Do you mind telling us, I happen to know what your profession is, but not everybody here will.
Oh, so I was a GP in Liverpool for 40 years, and thanks indirectly to David, I'm involved in this Get One, Give One worldwide vaccine campaign. Even that's drying up now because people are not being vaccinated so much, and they're also thinking it's all fine, why bother?
Yeah. Thank you. Thank you very much, Katie. And so that's bringing us towards the end of today's thing. It's whistled by, and I'm sure many other people would like to speak, but I love the way in which the chat is super active. Peter's got a wonderful illustration board that is absolutely full. Dave Harron has stayed on. This is amazing. I mean, you're still here, Dave. Thank you for that. And but most importantly, we've got a really good gang of 41 brilliant people on the call. I'd like to invite my colleague Mahika to do the goodbye and any kind of additional points she wants to make. Are you there? Yeah, you are, Mahika Acharya.
Yeah.
And Mahika, go right through, and then once you've indicated when the next one will be and give everybody a date, I'd like to say hello to various friends and family who are here.
Okay, will do. So I've just shared Pete's drawing. Wow, that is very detailed and very good. Thanks, Pete. And thank you everyone for joining. This was really an interesting meeting. I just wanted to thank Claire as well for highlighting the effects of long COVID and how dangerous this virus really is, how it affects all aspects of the individual and the society during a time when governments are relaxing restrictions. And Katie and Megan, I'm really sorry you have COVID and I hope you feel better. I found it really interesting how Megan said how you feel safer when the numbers were high. which shows that really like this is also a time for us to be brave within our own spheres of influence and be okay being the only ones wearing a mask when everyone around you is saying it's over. So thank you everybody once again. Back to you, David.
Thank you so much, Mahika. Wonderful. With that, I say goodbye.